Hi there, I'm Marsha Wykes, physical therapist at Giuffretti & Associates. I wanted to talk to you about some common causes for knee pain with some simple daily activities. Do you ever have pain in the front of your knee or knees when you're getting up and down from a chair or going down the stairs? We're going to take a look at a couple things that you might want to tune into to see if you can help yourself with that problem. So lots of times when people get up and down from a chair, without them being aware of it, what oftentimes happens is their knees will go inward like that when they're getting up. So you may not even be aware that you're doing it. But first step is tuning into it. Second step would be taking something like a TheraBand if you have it. And even if you don't, you could apply this principle without the band on. But if you tie the band around your knees, start with your feet about hip width apart. You're going to feel the band wanting to push your knees together. Your job is to keep that band open as you come up to standing and down to sitting. And that's teaching your brain to use those muscles on the side of your hip. You could think about the same thing without the band, just being aware of keeping a little bit of focus on that outward movement of your knees so you prevent the caving in. Same thing applies on the steps. If you're going down the stairs and you get pain in your knee on the leg that you're bearing weight on, what you may notice is that your knee actually caves in a little bit like this as you go down the stairs. So we don't want the knee to have that inward trajectory. So if you think about using the muscles on the outside of your hip and really tightening in your glute area, you can keep the knee pointed straight ahead as you come down the stairs. So just being mindful of working on that. Because you can see when I stand here, even if all I do is tighten these muscles on the outside of my hips, watch my kneecaps. You're going to see them turn out. My hips rotate out just a little bit. So this is my resting position, and this is where they go if I just tighten my glutes. So just being aware of that helps to prevent that caving in movement. So try those things with the stairs and getting up and down from a chair. If you don't find that to be completely helpful, then give us a call and let's see if we can help you out. Have a good day.